Okay, well, hi everyone. For the sake of time, we'll go ahead and get started. My name is Kat Rudolph. I am our state policy representative for the Iowa Academy of Nutrition and Dietetics. And this is the first year in January. We're doing more of a mini advocacy webinar. So this is meant to be a little bit more informal than our previous advocacy trainings that we've done in the past, mostly to just kind of give you updates on what's happening, give an opportunity for you to ask questions. And then as things move along in this legislative session, you might find that we'll plan these last minute if people are able to join or watch the recording, just to be able to give more information than we can in a newsletter, just to keep everybody up to date. So this will be recorded. So if there's anything that you don't want to be shared in the recording, you can make a note of that in the chat. The chat won't be shared publicly. If you want to make a comment that you want us to address and you want to make sure I don't say your name, you can say, please be anonymous. Just feel free to let us know if there's anything you don't want us to share on the recording. And if you are more interested in some more specific tips, practices, tips, examples, best practices when it comes to speaking with legislators or engaging in advocacy. We have done these types of trainings the last couple of years, and the recordings are on our website. So you're scroll through them and find the parts where we give some advice about advocacy and speaking with your legislators. Even if the legislative priority may shift from year to year. So just to let you know, we have lots of resources on our website. The public policy page is open even if you're not a member. So just to remind people, we have lots of resources to check out there. We'll go ahead and get started. So just a brief reminder that these are policy priorities this year. There's only so much that we could possibly keep track of and keep attention on. So our top priority this year is getting the Dietitian Compact legislation passed in Iowa. Any bills related to expanding access to dietitian provided services. And then any sort of bills that kind of tie into food access and healthcare access. Tina, I'm going to hand it off to you to talk a little bit about the Licensure Compact.
Sure. I'm Tina Bauermeister, and I'm the Consumer Protection Coordinator. So the Dietitian Licensure Compact, if you have not heard of that yet, it's a legally binding agreement among states that provides a pathway to practice so that dietitians can obtain compact privileges which authorize practice in states where they are not licensed. A state must enact the compact model legislation via the state's legislation process to join. Benefits of the compact include, right, what you see on the slide there: access to nutrition care and the continuity of nutrition care, increased telehealth opportunities, hopefully increased income and job opportunities for RDNs, and supports relocating military spouses and reduces the burden of maintaining multiple licenses. The Dietitian Licensure Compact is similar to any professional licensure compact like nursing compact, physical therapist, or psychologist compact. Dietitians who are licensed in one compact member state can practice in another member state by obtaining a compact privilege. A compact privilege is the legal authorization for a dietitian to practice in a remote state where they are not licensed. A dietitian must hold an active and unencumbered license in their home state and meet additional criteria to be eligible for compact privilege. A dietitian applies for the compact privilege and can legally begin working in the new state after eligibility is verified and then requirements are met and the fees are paid. So eligible dietitians must currently hold an RDN credential or have satisfied all the following: completion of an accredited education program, and then completion of supervised practice, and then completion of the RDN exam. A dietitian providing care in a remote state under a compact privilege will function within the scope of practice as individuals who are licensed in that state. It's the dietitian's responsibility to know where they are authorized, what they are authorized to do in the remote state based on the state's Practice Act. But it's interesting to note that the states retain their sovereignty over the practice of dietetics within their borders. Just a couple more informational things. So a home state is your licensee's primary state of residence. A licensee using the compact must hold an active, unencumbered license issued by their primary state of residence to be eligible for compact privileges. So think of it as like a driver's license. And the Dietitian Licensure Compact will have no impact on the state's requirements for initial license or license renewal. The compact is an alternative, optional pathway to practice by obtaining a compact privilege. You want to go to the next slide? Yeah. As of now, there are 4 states that have enacted legislation: Nebraska, Ohio, Tennessee, and Alabama. There is legislation pending in North Dakota, Kansas, Oklahoma, Missouri, Arkansas, Indiana, Kentucky, Mississippi, South Carolina, Rhode Island, and New Hampshire. Once we get to 7 states having legislation enacted, we can begin the process of a compact commission. A compact commission is a government agency established by the compact, and the compact commission will have 1 delegate from each member state. The compact commission rules are written in the bylaws to administer and implement the compact. Commissioners will be a designee from each participating state's licensing authority, and the compact commission is not a licensing board. It cannot affect state licensing requirements or take action against a licensee. Any questions about the Dietitian Licensure Compact?
I can just jump in here briefly. My name is Maddie Bradley. I'm part of the lobbying team for the Academy. We have worked with legislators to get the compact in drafting. So we have not seen the bill actually dropped yet, where we'll see the language and a bill number, but it has been drafted by the Legislative Services Agency. So in the next couple of weeks, fingers crossed, hopefully next week, we should see that dropped out of the House State Government Committee. Once that happens, then I will register, since I am a registered lobbyist, on behalf of the Academy in support of the bill, and we will also work to get other organizations to declare in support.
Thanks, Maddie.
You want to mention on the Senate side, or?
Yeah, so the Senate side has been a little bit more complicated. So there are kind of 2 ways that we can work to get the compact passed. Either the bill can go all the way through the House side and then get sent over to the Senate, and then again go through the subcommittee, committee, and then full chamber requirements. Or you can have a bill that's dropped both in the House and in the Senate. So they would be different bill numbers, but they would be companions. So we're working right now to see if we can get a bill dropped in the Senate. The 2 options there are really through the Senate State Government Committee or the Senate Health and Human Services Committee. We think we have a little bit of a better shot with the Health and Human Services Committee at the moment because they have introduced a handful of other compacts already that have had bill numbers and have dropped. So we are also waiting to see if that can happen. The language is with the Health and Human Services Committee, and we should know more next week about whether we'll have both of those bills, one in the House and in the Senate, or just the House bill. But either way, we should be good to go with the compact moving forward through the process.
Awesome. Thanks so much,
Great.
Maddie. And this is definitely, do you have something to say, Tina?
Oh, I just said thanks, Maddie.
Okay. And this is really informal. So please, anybody at any moment, will try to take pauses, or you can write in the chat if you want to ask questions. But really, if you have any questions about what's happening or this process, please feel free to chime in. And with that, I think it's helpful just to kind of give an update about how the session goes and the different dates and the things to be mindful of. So I'll let Maddie do that just because I could maybe do it too, but she's our expert. So we'll learn from her.
So this is you can see on the right here, kind of the picture of the schedule for the 2025 legislative session. We are in the first session of a new General Assembly, which means it is technically 110 days. So you can see here the first day of session was January 13th. and then that 110th day of session is May 2nd. That will not be when session ends. That is just the day in which legislators no longer receive their per diem, which is kind of a daily amount to help them manage either living in Des Moines when they live far away or commuting, getting meals, things like that. Typically, session will go at least a couple of weeks longer than that, just because there's still not agreement between the chambers on certain big pieces of legislation. You're foolish to try and predict when they will actually end session, but everyone tries to do it. I think this may be an early year. There shouldn't be any huge, very controversial pieces of legislation moving through, but you really never know. And then the other dates in there are 2 funnel weeks. These are kind of uh, weird Iowa things. A lot of states don't have funnel weeks, but we have 2 funnel weeks, which are basically just dates in which certain criteria have to be met for a bill to remain alive, to remain viable, to keep moving through the process. So that first funnel, March 7th, is when bills must make it through a Senate or House committee. So they have to go through a subcommittee and then the committee level. And if they don't do that, then they're not viable for the rest of the session, so they can't continue moving through the process. And then that second funnel week, a bill must have passed all the way out of one chamber and then through a committee in the other chamber to have survived that criteria. Did I miss anything, Kat?
No, you did a great job. And you learn more about how things work in other states too, because it's so funny that things work differently from state to state. I'm so used to the funnel now that that was a good reminder that might not be in place in other states as well.
I'll just add one more thing since we're being informal. So you know how I talked about kind of our 2 routes. One is either through the House alone, or one is dropping a bill in the House and the Senate. This second option, where we have a bill in the House and the Senate, is advantageous pretty much because of these funnel weeks. So when you have a bill in the House and the Senate that makes it through committee, they've already cleared a lot of these hurdles without actually having to pass between the chambers, if that makes sense.
We're increasing our likelihood
Correct. Yep.
of success by trying to get through the process by specific times.
Yep.
Okay, and then Maddie kind of already walked through this, so I don't know if you want to give just kind of the big highlight pieces of the bill process, just so people can see the language as well. But I know you kind of already explained this a bit.
Yeah, so to get a bill introduced, either the legislator can think of the idea on their own, or organizations like ours come to them with an idea. And so you have to have a legislator sign off to get it drafted and introduced either in the House or the Senate. So we talked about that. Then it will be assigned to a subcommittee. This is usually made up of 3, sometimes 5 members that will look at the bill and ask for public comment on the bill. So that's our time to go to the subcommittee and tell them why the compact is important. Also a time where people who would maybe be opposed can come and say why they are opposed to it. I don't anticipate that happening for this bill, but it does happen. And then the subcommittee will pass the bill out to a full committee, it depends on the committee, but about 15 members made up of Republicans and Democrats, but majority are Republicans because Republicans hold the trifecta in the state house right now of the Senate, the House, and the governor's office. The bill will be debated by the committee, and then it will go to the full chamber for the full vote. And then once it passes that chamber, it then gets sent over to the other chamber, and the same process happens again from subcommittee to committee to the full chamber.
And then finally,
and then the governor has to either approve or veto the bill. Vetoes are very rare, especially when all entities are Republican controlled, right? So she only vetoes, I can't remember the exact number, but a handful of bills. And sometimes she can only veto like a little line in the bill as well. So it's very unusual for her to do that.
Great. And then I thought this was helpful. So I created this visual last year when the compact was going through, just to give a visual and to give updates along the way of like where we're at in the process, so everybody doesn't get confused. But this is just kind of a visual representation of how this process looked last year. We got stuck in the House, but it didn't move on to the Senate portion. So hopefully we make it further down this pathway this year. Awesome. And then here are various bills that we're monitoring at the moment. Maddie, I don't know if you want to lead the charge on this as well. If you have any kind of updates on like the general context around these bills or what's happening since you are at the Capitol from day to day.
Sure. I'll start with Double Up Food Bucks. This was introduced by the Senate Health and Human Services Chair, Senator Mike Clemish, who is new to the role. So that's a really good sign when a bill is introduced by the chair of the committee. That usually means that the committee will certainly look at the bill. And it has passed the subcommittee. I'm sure it will easily pass the committee when that time comes. There is no companion in the House at this time, which can be kind of hard for appropriations bills. Bills that are going to appropriate money like this one. I believe it appropriates $1 million to the Double Up Food Bucks program. So there definitely are people working hard on this one. Anytime you're asking for money, it is a really difficult thing to get across the finish line. And then we also have the two other bills, eating disorder insurance coverage. This was introduced by Representative Megan Jones. We are in support of this bill. It has not been assigned or scheduled a subcommittee yet, so I don't know whether I can say if it's a priority or not for the Commerce Committee, but just kind of waiting to see on that one. And then the Grocery Reinvestment Fund, I believe, has a Senate companion as well, actually, and has passed a subcommittee. Again, this is going to be quite a large appropriation, so just really hard to get those fully across the finish line. And I know Caitlin's been working on that, and you just popped on if you want to say anything about that one.
Yeah, so I was actually going to say something about Double Up Food Bucks. So
Go for it.
I was in a different group this morning that's like hunger advocates, and they mentioned that there are legislators working on a House bill. They're trying to get a bunch of Republicans on the bill before they introduce it. So it sounds like it's pretty in the works. So someone just sent a list of legislators that might be potentially of interest. I can put that in the chat so folks can take a peek at it if they want to reach out and just share that they would be in support of this. Yeah, the grocery investment, I don't know a lot about that one. Just kind of bits and pieces here and there. So I don't know if I have a lot more to share.
And I would just also add that February 14th is the last day that legislators can introduce their individual bills. So we still have a couple more weeks for other bills to drop that we will be tracking.
And it sounds like, Maddie, you haven't really heard of any others that seem really relevant that could potentially pop up in the next couple of weeks.
I have not, no.
There
Okay.
are
And
a
of course,
couple.
our number one priority is the compact one as well. So we're just waiting for that one to get released. Caitlin, you were saying?
Yeah. I was gonna say there are a couple that have been introduced like in the school meals realm. So there is a Healthy School Meals for All bill. I believe it is on the Senate side right now. I'd have to double check. And it did just get assigned to subcommittee. No meeting set yet, but it was assigned to subcommittee. And then a summer EBT bill was also dropped by House Democrats. I don't know if it'll go anywhere, but it's there. So if anyone is looking at kind of some of those more school nutrition focused bills, those are a couple that have dropped so far.
Great, thanks. Just going to take a little pause if anybody has any questions about these bills. Otherwise, we can move on. Okay. And then this is a rule that came out related to continuing education for dietitians. It essentially allows for rollover of continuing education. So it's open for public comment until February 11th if you do want to put in a comment. But Maddie, it sounds like it should be pretty straightforward unless you want to give any other context related to this.
No, I agree with you. It should be pretty straightforward. Usually when a rule is proposed, unless there's really a stir against it, then it's just going to move through the process.
Perfect. So just an FYI for everybody, and if you feel passionate to write a public comment, but sounds like it should be pretty straightforward. And then finally, these are just some opportunities to take action. So the Day on the Hill is going to be Tuesday, February 25th. The last couple of years, we found a lot of success having scheduled meetings with smaller groups of individuals. I know in the past there was like bigger days that we held where people had to kind of put in pink slips and try to get a chance to talk to legislators. And you're welcome to join, anybody's welcome to join as well. We've just found like breaking off in smaller groups to have like longer 10 to 15 minute meetings with legislators that are tied to the legislation that we're looking at has been really helpful. So if anybody is really interested in coming, especially if you have any sort of stories related to the compact, how it impacts you, how it impacts your patients or clients, if you live on border states, and so it's important for people in your community to be able to get flexible care in different states, please reach out to us and let us know if you're really interested in coming and joining our Day on the Hill. And then I guess you're welcome to email your legislator about any of these bills that came through. So the double up food bucks, the HHS Senate Committee is the one that sees it next. So if you want to reach out, especially if you have a legislator on that committee. You can also educate yourself on the compact and start to prepare to contact your legislator when we do send out a queue for action. So we will likely have a letter template, but it is always super helpful to add your own personal stories. So if you want to start thinking about those already, you can like draft little like paragraphs or sentences on how you would want to share how the compact impacts you. And then even if you're really, really busy, when we say, hey, we need to get like contacts out to legislators and you already have that draft ready to go, you can take your personalized message, kind of plug it in and send it out. So if you know you're going to be really busy in the coming weeks, and we understand that this legislation happens really fast and it might be on a day that you're like, I don't have time to add my own personality to this letter, feel free to start thinking about it now so you can kind of plug it into the template we give you. And then just some updates that we have openings on our policy leadership. Currently, we still have a open position for state regulatory specialist. And then in June, I'll be taking a step back just to focus on my final year of the PhD. So if anybody's interested in taking on the state policy representative role, please reach out. I will be around. I am more than happy to train and support. I just need to take a little bit of a step back than I have the last couple of years. So those are just some opportunities to keep in mind. And that is our final slide. So if nobody has any questions, we can wrap up a few minutes early, but we'll stay on for the next few minutes if people have any questions.
I don't know if I told you guys this or not, but a few dietitians and we met with our representative and we just had coffee. It was just one morning. We all had to take off work, and but it still was really great because his name's John Wills, but he was very supportive of the compact, and so we're really excited about that. But he also, he asked if we had asked our senator to come, and I think we had, but he couldn't come, and so he said that he was going to talk to him about it. So just even if you just want to meet for coffee or just reach out, like you said, Kat, just with the form letter or whatever. But even just those getting together would be really great too, if you can. Even if you don't know them, still reach out.
Maddie, did I miss anything about how people can be preparing at this time? I know there's kind of perfect timing that happens when it comes to like reaching out to legislators. So I don't know if you have any insight you want to share on what people can be doing in the meantime.
I think you pretty much covered it. I think sometimes with this stuff, it's the hardest thing is just to wait. which maybe sounds weird, but right now we're just waiting to see the bill drop. We're going to see if there's any opposition from any legislators, and at that time we'll really know if there are certain people that we can contact. And then if you are a constituent of one of those people, that would be really, really great if you would reach out then. You can reach out now and say, hey, this compact we expect it to drop. And, I would be really grateful if you would be supportive if it comes to your committee. You can always say something like that. Any time for relation building is a good time. So whenever you get an opportunity to interact with your legislator, that can be great. But right now, I don't have any actual huge asks of people.
Great. Well, thanks everyone. Stay tuned. Stay tuned for emails. If any big action is happening and we feel like it's helpful to have another one of these calls, we might schedule another one if people have 30 minutes or want to watch the recording afterwards. But hopefully you found it helpful to get some more information during the session. All right. Thanks everyone. Take care.
Thanks.
Thanks.